Welcome to today's webinar, 5 Building Blocks of a Successful Analytics Program. I'm Stephanie Jones, Director of Member Engagement with Premier. Today's session will begin with a presentation, followed by time for Q&A. You can submit any questions you have throughout the presentation by typing them into the Q&A box you see on your screen, and we will be happy to follow up on any questions you submit. At this time, it's my pleasure to start today's webinar by introducing our presenter, Tim Riddle. Tim is a Senior Product Director for Analytics in Premier's Pink AI Clinical Intelligence portfolio. He has over 20 years of experience in healthcare analytics, leading high-performing teams, projects, products, and innovation functions. Some of his previous roles include performance improvement consulting, managing analytics and data science teams, leading product incubator and innovation functions, and overseeing more than a dozen analytics products from real-time to outcomes-based data at both large and small organizations. Tim earned his master's degree in Management Information Systems from the University of South Florida, an MBA from the University of Central Florida, and a Bachelor of Science in Psychology from the University of Central Florida. He holds a number of analytics certifications, including Certified Data Scientist, Product Manager, and Data Safety Expert. He has also been named on 5 patents. At this time, I'll turn the presentation over to Tim.
Thanks, Stephanie. Excited to have some time with you all today, and let's get started. Today, we're going to discuss the current market constraints that are headwinds to building a robust analytics strategy. We're going to recognize and review the requirements for a robust analytics strategy. We're going to identify approaches to future-proofing your analytics, understanding the impact that data quality can have on your analytics strategy, and then key lessons to equip your analytics team to be consultants or data storytellers for driving clinical performance improvement. The format of today's session is again, we're going to review some of the key industry trends. And then within each section, we're going to have some key takeaways from the market, the industry, some key tools to consider implementing to accelerate your analytics strategy, and then some PKI examples to really bring it home on some of the things we're doing with our members to drive their analytics strategy with regards to those key takeaways, industry trends, and key tools. So let's start with a quick overview of some of the general market constraints or trends at a higher level that might impact your analytics organization. It is obvious to everyone that works with healthcare data that the complexity and volume of healthcare data continues to expand, and it isn't letting up. Many organizations have rightly turned to their EMR to help solve this problem. And while this is obviously an important component, even organizations with the best EHR strategy can still continue to struggle. Recently, we spoke to an organization that was managing more than 170 unique data sources in their environment. The EHR was only one of them. So with this much complexity, how do organizations get the most out of their analytics program? The problem of driving improvement in healthcare isn't due to a lack of data. There is a tsunami of data in healthcare, and it isn't going away. One study indicated the average annual compound growth rate of healthcare data is more than 36%. This is well more than many other industries. In the last decade, there has been a 50-fold increase in data, and more than 40 times as much data was created in 2021 than in 2010. The other challenge is that despite almost 2 decades of standardized measurement, public reporting, and reward and penalty programs, in many cases, the average performance remains the same. A recent article and editorial in the Harvard Business or in the New England Journal of Medicine indicated that many of these problems might be due to even measurement from outcomes of process measures that are not tied to clinical research. The last is that data quality challenge and shortage of trained talent could limit the full implementation of AI and just analytics in general, which of course offers large benefits to organizations. A recent study in Harvard Business Review indicated that the mean data quality score for healthcare was only 55%. And while other industries struggle, this was lower than many other industries. And a final giant market trend is just labor shortages, right? Labor shortages could limit the full potential of AI and analytics programs in general. This recent article from Deloitte talks about how everyone is after the same small pool of talent, and that you need to develop alternatives, in particular hiring university graduates or returning internal resources so that you're not out fighting for the very few folks that you want to pull in from outside your organization. This is a key tip that we'll talk more about within this webinar. Based on the brief review of the industry background, it is not surprising that some of the same common themes are articulated by our analysts, data scientists, and other healthcare professionals from our members that are trying to use data to move the needle of the performance forward. A couple of examples of the problems we commonly hear, of course, I can't get all the data I need to power analytics. It takes too long to clean and standardize data. And we recreate the same dashboards and reports too often in our organization, which wastes valuable time and talent. With a review of some of these higher level market trends impacting organizations and their analytics environment, now let's move into what are some requirements for a robust analytics strategy for an organization. There are three critical approaches when thinking about the overall analytics strategy for an organization. And so let's go through a few of these. The first one is to enable self-service. A Gartner study indicated that as more content would be created by BI and business users than data scientists by 2019. The second thing to really consider is how do you shift your analytics strategy towards more of a product management mindset? This has been cited in Harvard Business Review and many other places. How do you start thinking of your product, of your analytics strategy as a product? Well, some key tips on that in just a minute. And the third strategy is to really how to incentivize and how to work with your organization to build a program that really centered around key small incremental wins rather than big bang. A McKinsey study indicated that as much as 70% of large transformational projects fail within an organization. Why? In part because the research suggests that larger plans and rather than incremental change and larger transformations are way more than an organization can bite off. And finally, Splunk in the state of digital transformation indicated all of these transformation efforts really come down to how can I turn data into meaningful insights? So when you think about starting a new analytics project, it generally looks like this. The workflow could be drawn slightly different no matter what you look at, but really there's four main fundamental building blocks. You figure out what data you need, prying it out of different silos. You work it into an analytics model, something hopefully that's simplified and allows you to create measures. You then work to integrate that data. And then finally, after you've done as much as 80% of the effort, you go to really trying to tell the story with the data. So a lot of the things to consider is how do you get these first three boxes and some of the tools and techniques we're going to share today to be as less of an effort as you can so you spend most of your time on that fourth box, really driving clinical performance improvement. So some of the key takeaways of enabling self-service. When you look at Coursera across millions of adult learners in analytics, the number one skill they're looking to train on is SQL, followed by Python. Now, while these are technical skills, they're non-proprietary technical skills. They can be easily learned and portable as the sands of time change, different analytics stacks become apparent. Consider non-proprietary technologies with strong user bases, such as cloud-based tools or even BI tools, such as Tableau or Power BI, that have a strong user base and that don't require a huge amount of proprietary technical skills. Have a clear and documented data model. So important when you're enabling self-service that you document your data model for your users. And then the fourth thing really on a key takeaway is have samples to modify rather than forcing users to start from scratch. So what are some key tools with enabling self-service? So one key tool really is project-based learning. The Open Group with more than 600 members really started implementing a training process for analytical skills and data scientists using a project-based approach versus just an analytical or pure just right in the bubble test. Many experts are now advocating for this approach to close data scientists and analytics gaps, especially among citizen data scientists. So this is a key tool to think about as you're growing the ranks from within your organization rather than fighting for outside talent. What are some of the things we've implemented at Premier along those same lines with those industry trends? The first is we built an analytics self-service framework that is based on Microsoft Azure and SQL and Tableau, so that our organizations don't need to learn proprietary stacks and tools. We've simplified the data model, and we've also had a community of experts, so you don't have to start from scratch. Second key approach is to really approach your data and analytics with a product management mindset. So this is common among AI and analytics startups. Um, a common tool is called the Business Model Canvas, or BMC, and is used by more than 75,000 companies when they evaluate what they're going to do from a startup perspective. Another key tool is to consider name subject matter experts within your team for domain areas, even on small teams. And also don't forget to consider outside sources for subject matter expertise. So this key tool of Business Model Canvas, or derivative, ensures that you center your projects around business value. This might sound kind of like saying water is wet, but you can use this for a project or a specific metrics, and consider your remeasurement and data collection strategy when you're assessing it. So this is what that tool looks like. What's important about this tool, and a tool I'm going to show you that we've adapted from this premise, is that you are forced to answer key central questions about your analytics project up front, saving you time and making sure you have the right scope, such as key stakeholders. What is this project going to be used for, and how's it going to drive value? At Premier, we've adapted this to have a very specific use case guidance worksheet. Now, this is just one example of a tool, but these tools allow you to really focus your analytics project or metrics and ensuring that you get critical business value out of the project before you even start. The final requirement for robust analytics strategy is really think about how you center your organization around small incremental wins. So there are tons of research in the industry that indicate big bang analytics and transformation projects have a very high failure rate. Consider how to center your approach and your analytics strategy around pre-cleansed data or measures that act as Lego building blocks to smaller incremental wins. Have an environment that allows and considers rapid iteration, as in an environment that's already set up to handle EPHI and data flowing into it, and hopefully reload it on an ongoing basis. Focus your projects, hopefully, with no more than 4-week or less turnaround time. Now, some key tools to do this are to evaluate best practices around agile analytics from experts like Ken Collier at ThoughtWorks or others, and working with that business model canvas or other like tools to right size and scope metrics that matter. Here are some specific examples from our members that have created these small tactical use cases. Now, you can have small use cases that build into a larger initiative. That's one approach. These are very tactical examples, such as investigating the adverse drug events related to an opioid utilization. But if you had a narcotics control kind of overall analytics project, you could take that one piece and a few other pieces and stitch them together so that you still have an incremental project, but it builds to a larger initiative. With so much constant change, now let's discuss some key statistics and consideration for organizations when it comes to future-proofing their analytics strategy. Technology constantly changes within the analytics space. So one thing to consider within this space is, how do you focus on process and strategy rather than spend all your time on learning the latest analytics tools? A second important perspective is that a recent study indicated that 88% of organizations use more than 100 spreadsheets to regularly make their critical business decisions. So for this, consider using a measure library or measure management strategy rather than embedding all your logic in your analytics program into spreadsheets or business intelligence tools. The third important point is investments in simplifying and documenting data have a longer shelf life than tech alone. So if you look at the definition from Gartner of even self-service analytics, they talk about how a simplified data model really is important for self-service analytics. So when you center your strategy, think about the investments you can make in simplifying the information for your end business users as you work to accelerate your self-service within your organization. So that leads into some of these key takeaways. Growing analytics team skills using non-proprietary or industry-leading technology. So skills like SQL and Python, maybe even some AI skills, but those skills remain portable regardless of how often the technology shifts. Embed important business logic in ETL or data layer, and not within spreadsheets or BI tool as much as possible. And focus on the fundamentals to simplifying your data model and automating key measures so you have those building blocks and don't have to start from scratch every time. A key tool around this is to consider the difference in your measurement strategy between process measures and outcome measures, and make sure you have a mix of both, which goes into one of my future proofing tools. Use or consider a measure library. Here's a definition for AHRQ on outcome versus process measures. But one important tool is to really think and have in mind of a mix of both when you're looking at your healthcare analytics strategy. So outcome measures are things such as mortality rates, right? They're things that are considered in some cases the gold standard for measuring quality. But as AHRQ mentioned, sometimes many of these might be outside a provider's control. You want to have some of those outcome measures, but mixed in with some of the process measures. A good example of this is the percentage of time a DVT prophylaxis is given versus how often a DVT or pulmonary embolism happens within the organization. Therefore, you have an outcome measure followed by process measures. Some examples of Premier of how we've adapted and talked about and worked with the organizations around those key takeaways and trends is making sure that our technology complements current technology in place at organizations, making sure we accelerate the time to value for our organizations with simplified data model, clinical measures and indicator library, and queries and visualizations that are shared from the community. An example of that is our measure library, where we have over 1,400 measures that are continuously updated based on our new data. And again, the point here is to really think about your remeasurement strategies in an organization. If you're measuring something like AHRQ never events, and they can be continuously updated and measured with as new data flows in, then you know you don't have a risk of backsliding as an organization. Another thing is to make sure you complement your analytics strategy with removing the burden of data curation and preparation, shifting to real-time analytics and accelerate the transformation. What you're really trying to do is make sure you limit that 80% we talked about earlier. This is a critical and important tool, is to make sure you simplify and normalize your data model for self-service analytics and for more business users that might have a little bit of technical skill. So again, spending time on making sure that the model is easy to use and understand, even if this is not a full enterprise data warehouse, it doesn't need to be that. But for the domains where you're looking to report on, make sure you spend some time simplifying and standardizing your model so that a lay business person can get in there and do the analytics and self-service they need to do, taking some of the burden off the rest of the analytics staff. So now let's turn to what impact does data quality have on your analytics program. Let's review some of the current data quality problems within healthcare and their impact on a successful program. Data quality is often overlooked and problems can daisy chain. As was talked about by Andrew Ng, the founder of Google DeepBrain, is that data is the food for AI. Without good, clean data, you're not going to get much out of predictive analytics, analytics in general, or artificial intelligence within your program. It often takes too long to clean and standardize data so you can use it for analytics. Some statistics cite as much as 80% of the data scientists and analyst prep time is on data standardization, which is a direct result of data quality. And then the third thing is consider the newer approach of agile data governance. You're never going to get everything perfect overnight. So agile data governance and looking at some of those principles allows you to incrementally build your data quality without thinking you have to solve every problem for the organization. Again, talking a little bit more about Andrew Ng's initiative. So again, a founder of Google DeepBrain, what he really talked about is a data-centric approach to analytics and AI allows the organization to have less need for significant PhD kind of trained data scientist resources. It allows them to use some of the off-the-shelf tools with smaller data sets and no significant AI experience. So again, data quality is critical in implementing simple analytics, but even predictive analytics. Another study by Google Research really talked about everyone wants to do the modeling work, right? The complicated predictive analytics, but no one wants to do the data quality work. And up to 92% of organizations feel the negative impact of not having good data quality. So with some of those trends, what are some key takeaways and tools to help think about data quality and how it impacts your analytics organization and how you can improve? So obviously, as mentioned, data quality is a key impact on AI and analytics strategy. does not need to be complicated or require complicated tools. You can start small so that problems don't magnify. Consider your remeasurement strategy and the time to prepare your data for your team. Try to drive that down. Maybe you can have a tracking spreadsheet on some projects to really discuss with your team how long it takes to get the data into a stage where you can begin a project. Review and have a clear understanding of what data can be used for what and what its limitations are with key stakeholders. As an example, HL7 or real-time clinical messages have a different data quality than data from coming out of, say, a building system. So a couple of key tools to takeaways here is evaluate agile data governance tips and techniques. This is available from Gartner and others. And there's a key study from Gartner on 12 steps on how to improve your data quality. Some of the things we've implemented at Premier to work on some of these key trends is that we automate and map data from different systems into standard codes and techniques, such as laboratory to LOINC, pharmacy to standard drug codes, and new charge codes to our own standard proprietary thing. The thing we're doing here is making sure the data is standardized for consumption. It's a key critical point to consider as you're looking at different things to automate from your analytics standpoint. The other thing we do is that we make sure that that data is mapped and ready to be used for analytics immediately. As mentioned, one of our data domains goes through more than 200 plus quality rules to ensure the data is clean and for reporting. Obviously, if you're starting in a specific data domain, we have a long history within that data domain, so you might not get there. But really think about the strategy of how you link your data together and how you introduce some simple quality rules to make sure that data is more standardized than not when you get ready to create a project. And here's an example of just a simple documentation. As I mentioned, some of these things don't have to be complicated. This is an excerpt from our indicators, measures, and library. And what you can kind of see here for the business users is clear indication and documented on an excerpt here, which was from blood utilization. Final thing to really consider is how can I equip my organization to tell a story around your particular data to drive performance improvement. So some key thoughts and statistics around this trend. The fundamentals are not replaced overnight. They have a longer shelf life. As mentioned before, countless organizations are really dialing up their analytics to remove the glut of just dashboards and storytelling. What organization we talk to have 10,000 dashboards within their organization? That's not telling a story. That's overwhelming people with dashboards. So really think about the skill of narrowing the noise within all these dashboards to tell a story for the organization to drive your performance improvement. And we'll have some techniques here in a minute. Again, with the talent wars, everybody seems to be going after a certain sort of skill set. Really think about your internal resources. We'll have some tips on that in just a second. And data storytelling can be taught and learned. This is an article from HBR, but really cites that few forms of communication are as persuasive as a compelling narrative with visualization in it. And so in many cases, it's not statistics that drives performance improvement, but how you tell the story. So some key takeaways and tools. Data storytelling takes time, either to learn or to drive improvement. So work to ensure environments are pre-configured to take the burden off, back to that 80%, and provide your team more time to tell stories. Consider a project-based learning program. Again, maybe taking some folks that are showing internal aptitude with telling stories, even if they're not traditional data scientists or analytics professionals, and giving them specific projects where they visualize the data and how it might impact their organization. And really think about providing building blocks for everyone. So some reusable templates that prevent reinvention and help tell the story for certain items like patient lists or variability, where you're going to need to tell the same story overall. Some key tools, as Tufty and others, have inexpensive visual data storytelling courses and books. I highly recommend them. These can help train novice users on how to tell a story with data. Many of the communities for tools have good visualization examples or keep some public examples such as Tableau and Power BI and others. Really check those out and evaluate some of your favorite examples. And that goes to the third point, is really track the time data prep or other environments take to get data ready for a project, and hopefully drive that down so you have more time. for data storytelling. So some of the techniques we've implemented at Premier is make sure that data is always loaded continuously in the environment, and it's been linked together to allow for rapid access between different data domains. We've leveraged existing clean and standardized and map data for analytics, so you can get going immediately. This includes a high performance analytics environment where all the data is loaded and visualization tools that are already pre-hosted with some examples, which we'll talk about in a second. We've really allowed the data to be linked together. In this example, we've linked some documented infection outcomes on when a central line was inserted, along with outcomes, so you can visualize key points of both clinical process variability, along with longer term outcomes for patients. We've built some accelerators. Again, some examples would be that you've got some templates for your organization on how you want to do a histogram or patient list, as well as some SQL examples for some of those writing more analytics-based scripts that you can use to not have to start from scratch. And the community resources. So we've got lots of resources outlined. It doesn't have to be this thorough, but as you're thinking about an analytics program, how do you provide some resources to some of your self-service users? So again, they don't have to start from scratch. And then finally, we've enabled a analytics kind of visualization library that's continuously updated and added to by our user community so that folks don't have to start from scratch when they're visually telling a story. So now let's talk a little bit about the summary of what we reviewed. Today, we talked about building a robust analytics team and some strategies for organizations to consider addressing pressing market forces. The volume and complexity of data quality continues to be a problem, and talent that is in short supply. Analytics leaders can achieve success and future-proof their analytics strategy, starting with clean standardized data and utilize industry standard non-proprietary tools. I want to thank you for your time today. And now we're going to open it up with Stephanie for some questions.
We only have a few moments, but let's take a couple of questions. Tim, here's the first one. If my system uses several different systems, where do I start to create a clean and normalized data set for my team to work from?
Thanks, Stephanie. I think one of the first things to consider is what set of data do you perhaps use most as an organization? Now, as we talked about with data quality, and Rome wasn't built in a day, take one of those high value sets of data, such as your billing system, or even some parts of your clinical system, and work to maybe consider standardizing that. I mean, you don't have to build an entire EDW with 170 unique source systems to get value out of it. Pick some of the low-hanging fruit that might have the most usage or usage as an organization, and then work to maybe improve the data quality and the standardization of that particular set of data, and then build from there.
Okay, this next one has two parts. What is your approach to quality measurement? And then how do I know my measures are asking the right questions for the best outcomes for my patient population?
Right. So, I mean, there are many different and multiple different approaches to quality measurement, obviously. I think the approach that makes the most sense in today's market is, again, going back to those outcomes versus process measures. What you want to ensure is that you have a mix. And process measures in many cases are more critical even than the outcomes measures. Now, the challenge here is that outcomes measures are traditionally how CMS and some payers and even some public with star ratings, right, rate us. But in order to drive those outcome measures, you have to have lower level process measures that can drive those outcome measures. And a great example I mentioned before is DVT prophylaxis versus DVT, right? In order to drive down the incidence of, hospital-acquired DVT or PE, you need to ensure that you have some of those process measures, like how often do you give DVT prophylaxis for specific patient populations, in control. And so I think ensuring that your outcomes and process measures are balanced, and for a key area, you have both to help impact your outcomes measures, you have to have some process measures.
Okay, thanks, Tim. And we'll take one more. My data has a lot of consumers. How are other organizations creating a data strategy to satisfy analyst and executive needs?
Well, there's lots of ways to attempt to and tackle this. The one thing I would say is really ensure as you're creating a simplified data model or as you're thinking about a data domain to really standardize and turn into a higher quality data strategy. To start at the transactional level and then move up into patient and organizational measures. What that allows you to do is to satisfy both the executive level consumer on some higher level measures, even at the organizational and training perspective, but then have it tied directly back to the exact data for an analyst. If you take higher level measures that aren't sourced from the transactional data, then you always end up with different counts. And that's a real problem for and challenge for many organizations. So one of the first approaches is to make sure that your transactional data will meet those organizational level measures. For example, within Premier, we have patient level and transactional level measure that show every HRQ never event, and then that rolls up into the organizational measurement strategy so that you can see that at a trended kind of monthly level if you're an executive. But as an analyst, you can see every patient that had one of those, say post-op sepsis or wound infections or things like that.
Great. Thank you, Tim. We'd like to thank everyone for joining our webinar today. If we didn't get a chance to answer your question live, we will follow up with you after the webinar. This concludes today's presentation. You may now disconnect from the meeting.